Hello, my name is Fred Kusamoto, and it's really my pleasure to get together with Firas Zawi tonight, if only two-dimensionally, to really talk about sort of his most recent experience at Heart Rhythm. So, Firas, go ahead and introduce yourself.
Thank you very much, Dr. Kusamoto. My name is Firas Zawi, and I am a cardiac electrophysiologist practicing in Detroit, Michigan area and part of Ascension Heart Rhythm Institute. It was my pleasure to attend in person the Heart Rhythm Society meeting, which was a fantastic meeting. We missed a lot of friends and colleagues, but hopefully next year we'll see all of them there.
Yeah, I agree completely. I mean, we've kind of gotten used to this Zoom thing, but it's clearly no substitute for getting together. And I know you feel the same way as I. I mean, there was just so much excitement in the air, being able to actually see each other three-dimensionally. And for those who felt comfortable, give each other a hug and just say, God, it's just been so long. And, it is just so special. It makes us all realize how connected our world is. So when you went to Boston, so what got you excited? What was a session that really sort of got you interested?
So most of the sessions I attended were fantastic. This one of the sessions I really liked was the innovation in catheter ablation. It was presented by three fantastic electrophysiologists, talked about the most updated innovation and available energy source for catheter ablation for arrhythmia. Dr. William Sauer talked about how to achieve a better lesion, a deeper lesion using a standard radiofrequency ablation with a standard equipment available in most of the electrophysiology lab. He talked about doing a deeper lesion with a longer duration, with a higher power, using a bipolar ablation for some of the ventricular tachycardia catheter ablation cases, using half normal saline, which seems to be effective and safe to do in some of the challenging cases as a bailout. He also touched base about doing a deeper lesion with some other techniques using like an RF needle and so forth. Then Dr. Jacob Korath from Mount Sinai talked about the state of the art with the pulse field ablation. He highlighted the new techniques for the pulse field ablation, and he summarized in the two slides the difference and the similarity between radiofrequency ablation and the pulse field ablation. Also, he finished by what's unknown or what can go wrong as well with a pulse field ablation as well. So it was very informative and a good session to keep us really thinking about pulse field ablation, how we can improve and how can incorporate it in our practices. Then Dr. Shiv Kumar talked about ablation for cardiac ablation for non-arrhythmia, especially highlights the possibility of using ablation technique and some other cardiac abnormality or pathologies. Especially he highlighted the hypertrophic cardiomyopathy and the use of catheter ablation to reduce the left ventricular outflow tract gradient in those patients with have high gradient as well.
Yeah, Firas, doesn't this show us, even as experienced electrophysiologists, you've been in practice for a while and obviously incredibly experienced, but we all face those incredibly difficult patients in the lab. And,
Absolutely.
What tricks can we use right now with the stuff that we have and, kind of Absolutely. What's out there in the future? I mean, that is so exciting to think about. I mean, that's really one of the great things about these sorts of sessions, right? It's the ability for all of us to get together and sort of share these best practices.
Absolutely.
Yeah. Hey, so we have a moment or two left. What's another session that you'd like to highlight that really got you excited?
Yeah, one of the sessions I really liked was a debate about left atrial appendage isolation, electrical isolation for patients with persistent and long-standing persistent atrial fibrillation. This is a difficult type of patient, and we are trying to achieve a better outcome, a better freedom for atrial fibrillation. So that debate was between Dr. DiBiase and Dr. Verma. Dr. DiBiase was pro left atrial appendage isolation for patients with persistent long-standing persistent atrial fibrillation. He shared his fantastic experience and research paper showing that additional isolation of left atrial appendage can improve the outcome of atrial fibrillation ablation in those population, and also it's safe without significant increased risk of stroke of patient who is compliant with anticoagulation without any interruption. Dr. Verma shared his experience about increasing risk, or his concern about increasing risk of stroke post left atrial appendage isolation. And he also mentioned the data about like how until now, unfortunately, we don't have a solid evidence that anything beyond pulmonary vein isolation can improve the outcome of the atrial fibrillation in patients with persistent and long-standing persistent. That debate was very informative and helped us to see there's a possibility, there's a potential, we can look at it in the future, but still there is a lot of work to do for those type of patients.
Yeah, I agree, Ferris. I mean, I tell you, back in the old days when we would do young people with paroxysmal atrial fibrillation, right, and the focal atrial fibrillation, and now we're taking on these difficult patients, with persistent atrial fibrillation, where, boy, there's obviously a lot of debate on sort of what to do. Well, I want to take this moment to thank you for sharing this time with us about the highlights for you about Heart Rhythm in Boston. I know that Andrew Cron and Jody Hurwitz did a phenomenal job working hard to have both a virtual and an in-person session together. I really appreciate it. And I want to thank you personally for being an HRS pace setter. Your activity in social media, getting that message out there about arrhythmia care to the broader community is so vital. I just want to thank you for that.
You are welcome. And I would like to thank you and thanks all the Heart Rhythm Society team and members for putting all this effort to have us in person, meeting friends and colleagues and trying to advance the field. And we look for the next year Heart Rhythm Society meeting as well.
I agree. It does take a village, right, to take care of these patients with arrhythmias. Thank you so much, Ferris.
You are welcome. Thank you very much.